He says hospitalization rates among children for COVID-19 are at their highest rate compared to any other point during the pandemic. Fox 12's Bridget Chavez joins us live now after speaking with a pediatric doctor at OHSU about what we're seeing here in Oregon. Bridget?
Yeah, Dr. Erickson from OHSU says that there are 19 children across the state of Oregon currently hospitalized with COVID-19. And while that number may seem small, he says it's the highest it's ever been, and he's worried it could get worse. Across the country, more children are being hospitalized for COVID-19 than ever before, and the same is true for Oregon.
Right now, we have more children hospitalized with active COVID infection in Oregon than we have at any point during the pandemic.
Dr. Carl Erickson from OHSU says statewide there are 19 kids in the hospital for COVID-19. 6 of them are at OHSU and 10 at Legacy. Keep in mind, these numbers are always changing. Erickson says the pediatric patients at OHSU include children too young to get vaccinated and older patients who are not vaccinated.
Not a very high number, but keeping in mind that it is relatively uncommon for children to be hospitalized. It is a number that we're watching very closely.
Erickson says he's seeing pediatric patients hospitalized both specifically for COVID and also for other conditions when they test positive for COVID. But he says they need more data to know if there is a trend either way.
We're seeing a combination of kids who have severe COVID infection and are very sick with COVID itself. That's at the severe end of the spectrum. At the milder end of the spectrum is maybe somebody who has COVID and it's either caused an exacerbation of an underlying chronic illness, or sometimes is actually even asymptomatic, or we can't really see a clear reason for it to be tied to the hospitalization.
As we continue to see cases of COVID-19 rise, Erickson says he's concerned more children will require hospitalization.
What we also know in kids is that in addition to getting sick with COVID-19, they can also get sick from an inflammatory syndrome that happens weeks after they've had their initial infection. So we will often see a spike in COVID-19 hospitalizations, and then a few weeks later see a second spike of this post-COVID inflammatory syndrome that we call MIS-C, multi-system inflammatory syndrome.
Erickson says the most effective tools we have to protect children are the COVID-19 vaccines, followed by masking and avoiding large crowds.
We're all very concerned about the fact that we still have a pretty significant population of unvaccinated kids who are at risk for serious complications with COVID, and those complications include hospitalization, needing a mechanical ventilator, and death, unfortunately.
Erickson says they don't have the tests available to determine whether or not this is the Omicron strain of COVID-19, but he says because most cases in the state are turning up that way, they are assuming that most of them are Omicron. Reporting live in Northwest Portland, Bridget Chavez, Fox 12 Oregon.